Good morning, dear students. Today we are going to discuss the development of face. Before moving on to the development in particular, just a brief revision of the general embryology you have studied. Here you can appreciate the side view of a developing embryo, where cranially there is a presence of developing forebrain and another bulging caudal to it is the developing pericardium. Now, in between these two bulgings, there is stomodium which is separated on the outside by the buccopharyngeal membrane, as you can see in the label diagram. Now, this cranial bulging develops a hook-like projection that overlaps the upper part of stomodium. This overhanging projection is named as frontonasal prominence. Now, you can see here in the diagram, it is written as process, whereas I have written it as prominence. So both are correct. You can either use prominence or you can use process. Like in the receiving, it is written as process, whereas in Langmans, you will find it as prominence. So moving ahead, here you can see both the views. That is the side view of a developing embryo and the ventral aspect of the developing embryo, where you can find frontonasal prominence. Then going caudally, you will find maxillary prominences on either side of the developing stomodium and the mandibular arch caudal most. So this is at the end of 4th week, where you can find 5 facial prominences. That is 1 frontonasal, that is unpaired, 2 maxillary prominences and 2 mandibular prominences. Now, on both sides of the frontonasal prominence, local thickenings of the surface ectoderm appear, known as nasal plecodes. These nasal plecodes invaginate to form nasal pits. Here you can see the nasal pits, and surrounding these pits, as we dig a hole in the ground, pile up the soil around that hole. Similarly, nasal pits are formed. They create a ridge of tissue that surrounds each pit and is known as nasal prominence. Now, this nasal prominence around the nasal pit is divided into 2 components, medial and lateral. Medial component is uh, medial nasal prominence, that is shown in yellow, whereas the lateral component is shown in blue and is known as lateral nasal prominence. So these are again bilateral and paired. The orange colored structure you can see is the maxillary prominence, and these maxillary prominences, when they increase in size, they compress the medial nasal prominences, thereby causing the fusion of maxillary prominences, and this leads to the development of upper lip. So this upper lip is formed by 2 medial nasal prominences which are fused together and the 2 maxillary prominences. The maxillary prominences form the cheek and lateral part of the upper lip, whereas the philtrum of the upper lip is formed by the 2 medial nasal prominences. Here you can appreciate that these lateral nasal prominences are not participating in the formation of upper lip. So the take-home message here is face develops from 5 facial prominences, that is 1 frontonasal, 2 maxillary and 2 mandibular prominences. And the upper lip is formed from medial nasal and maxillary prominences only. So thank you for the patient listening. Have a good day.